في الصلاة. الله أكبر الله أكبر، لا إله إلا الله.
لا إله إلا الله. Quick reminder, inshallah, after Salah, we will have our healthy living program. And this time we are discussing breast cancer since it's Breast Cancer Awareness Month. May Allah protect us all, Ya Rabbil Alameen. استووا واستقيموا واعتدلوا. الله أكبر. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين وما يستوي البحران هذا عذب فرات سائغ شرابه وهذا ملح أجاج ومن كل تأكلون لحما طريا وتستخرجون حلية تلبسونها وترى الفلك فيه مواخر ولتبتغوا من فضله ولعلكم تشكرون يولج الليل في النهار ويولج النهار في الليل وسخر الشمس والقمر كل يجري لأجل مسمى ذلكم الله ربكم والذين تدعون من دونه ما يملكون من قطمير إن تدعوهم لا يسمعوا دعاءكم ولو سمعوا ما استجابوا لكم ويوم القيامة يكفرون بشرككم ولا ينبئك مثل خبير يا أيها الناس أنتم الفقراء إلى الله والله هو الغني الحميد إن يشأ يذهبكم ويأتي بخلق جديد وما ذلك على الله بعزيز. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. بسم الله الرحمن الرحيم. الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. بسم الله الرحمن الرحيم. أرأيت الذي يكذب بالدين فذلك الذي يدع اليتيم ولا يحض على طعام المسكين فويل للمصلين الذين هم عن صلاتهم ساهون الذين هم يراءون ويمنعون الماعون. الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الله أكبر. الحمد لله الرحمن الرحيم إياك نعبد صراط غير المغضوب عليهم. الله أكبر. سبحان الله. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. صراط الله أكبر. سمع الله لمن حمده. الله أكبر. الله أكبر. الله أكبر. الله أكبر. السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. استغفر الله استغفر الله استغفر الله استغفر الله. لا إله إلا الله وحده لا شريك له له الملك وله الحمد وهو على كل شيء قدير. إن شاء الله.
Assalamu alaikum wa rahmatullahi wa barakatuh. Inshallah, my brothers and sisters, we have an amazing program happening tonight. In the Musalla, there's going to be the ongoing conversation about breast cancer here. In the other hall, we're going to have a conversation about education and the Memphis Islamic Center Education Fund. And inshallah, there'll be dinner served in the other hall as well. So I encourage everybody, if you're staying here, stay afterwards, join us. and have food. And if you're coming on the other side, we'll serve dinner right after the short presentation. Tomorrow, 11 to 5 p.m. is the Youth Leadership Summit. So if you have kids who are teenagers, 13 to 18, bring them to the masjid. We'll be doing a one-day leadership summit with certificates and everything as well, right in the youth program. So again, stay here for the medical program. Over there is for the education one. And then once you're done, please come over and enjoy the dinner as well. Assalamu alaikum.
Assalamu alaikum. Alhamdulillah, Brother Faizan, just to add on to what he was saying, I've seen the report of the people that have benefited from ACC, alhamdulillah, and it's our local students, our local Memphians. The money that was raised last year went towards people in our community that benefited from it, alhamdulillah. So your money is going back to the community, and there are no strings attached. So if the students are interested in it, when those cycles open, apply. There's people that have wanted to apply off cycle, and when it opens again, make sure you apply. And for our community itself, make sure that you donate, you support, you help. You can learn more about it in the banquet hall, inshallah. Also, in regards to those that have signed up to participate in the get. Okay, Sheikh Yasser has asked me to ask people to leave. If you're talking, if you're hanging out, you're giving high fives right now, you're socializing, you can do that. We ain't stopping you, I promise. But just do it outside. The folks in the back, socialize outside, inshallah. You can socialize where there's dinner, you can socialize outside. There's a million things going on, alhamdulillah, at MIC tonight. You can pick one, but in the musalla, inshallah, we'll keep it quiet. The other thing too is the Get Fitness Challenge. Tonight we've had the clinic taking everybody's vitals for those that are wanting to participate in it. That's going to be continuing. So if you haven't taken your vitals yet, or you do want to participate and you want to learn more about it, we're going to continue that in the cafe area, inshallah. And that is where we'll take your vitals, and these are the vitals that are going to be measured on you for the next couple of months to see how you improve over the next couple of months. And remember, the grand prize is an Umrah trip. So there is some stakes involved with it. It's an Umrah trip involved. So if you are interested, that will be continuing in the cafe area.
Okay, Shabab, so Assalamu alaikum wa rahmatullahi wa barakatuhu. Very delighted that, mashallah, we have a lot of talent in our community. And these are people who are willing, and they have been sharing their talents with us. And tonight, mashallah, we have two of them. We have Dr. Sean Khan, and Dr. Minhas, Sohail Minhas, inshallah. And they will be taking us through just learning more about breast cancer. And subhanAllah, earlier today, sister called me and she said, it is in our family. And she was wondering, she was very scared to go and get checked because she said that she just found out that she has a cousin, she has an aunt, she has another cousin, another aunt. And she said that she also, her own sister, was diagnosed with breast cancer. And she said now she's very scared. She does not want to go to the doctor because she's afraid that they're going to give her some bad news. So inshallah, having said this, I'd like to invite Dr. Khan and Dr. Minhas to please come in, and we'll take it, inshallah, they'll take the discussion from here on. Also, inshallah, promoting healthy living in our community. Outside, we're doing vitals, specifically taking weight, fat composition, and I've got to tell you, we've got some big people here in the community. And hopefully, inshallah, you're not one of them. And you are one of, if you're one of them, inshallah, hopefully you're working on getting smaller, inshallah, because we would love to see people being healthy. As you know, that afiyah is one of the gifts from Allah subhanahu wa ta'ala, state of health and well-being, is a gift from Allah that we need to appreciate and maintain. Dr. Minhas, yep, please, inshallah. Jazakallah khair, thank you for being here with us. Appreciate your presence. So inshallah, having said this, John, it's all you too.
Check if you want to do the screening on the MRT. If you want to grab Afan and Nima.
Yeah, we'll do it in the cafe.
If you could just tell me.
Yeah, okay, inshallah. Yeah, so inshallah, the vitals will go on until inshallah this program is over. And you can just quickly, in and out, or later on, inshallah, after the program, make sure that you get your vitals, inshallah. And of course, all the information that we get is confidential. We only share it with MIC community members, inshallah. So,
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيد المرسلين محمد وعلى آله وصحبه أجمعين اللهم انفعنا وارفعنا بما علمتنا وزدنا علما وفقها في الدين يا رب العالمين. السلام عليكم ورحمة الله وبركاته. You all must be sleepy. Assalamu alaikum wa rahmatullahi wa barakatuh. That's a little bit better. So I'm very happy to have Dr. Sohail Minhas with me here today. He is a longtime community member who's been here for over 30 years, I believe, right? And he is a board certified medical oncologist. So you may be like, well, what is an oncologist? He is a specialist in all types of cancers. He is a cancer doctor. He knows how to diagnose and treat cancers. Dr. Minhas got his education in Pakistan, where he did his medical school in the 80s, and then he did his residency here in Memphis, and also his fellowship here and in Washington, in Seattle as well, in his oncology. And he's been practicing for over 25 years, mashallah, as an oncologist here in the community. And today, we're going to just kind of have a conversation about breast cancer. Breast Cancer Awareness Month is this month, is October. And it's one of those cancers that are, the majority of our people that have it are women. There's a very small amount, less than 2% or so, and you can correct me if I'm wrong, who have male breast cancer, but the majority of folks that have it are women. And it is a disease that can be treated. It's also a disease that can be caught early and prevented, but there's a hesitation in our community. And we're going to have a conversation about what to look for, what are the types of breast cancer, and what can we do to support our sisters in getting an early diagnosis and treatment, inshallah. So without further ado, if you could check your mic. Hello. Right here. Turn it on. Now you can test.
Hello? Yes, I think you can hear this.
So, Dr. Minhas, if you could just enlighten us a little bit about some of the statistics that we see amongst the general population, and then specifically amongst Muslim women with respect to breast cancer, like what is the incident, like how many women get it a year, what is the mortality, and things like that.
Okay. So basically, that's one reason we are gathered here, because this month is the Breast Cancer Awareness Month, and the main message from this is to go ahead and get your mammograms, go get your testing done for breast cancer, and just make the public aware of that. So the statistics are like breast cancer is the leading cause of cancer in women, and the leading cause of cancer death in women. And worldwide, if you look at the statistics, it's like 2.3 million women will be diagnosed with breast cancer. And, and there's like one out of, in the world, if you look at 1 out of 5 women will probably survive breast cancer. No, like 1 out of 5 women will die from breast cancer. In the United States, we have projected for this year, for 2025, let's say about 316,000 breast cancer diagnosed, and about 40,000 women will die of breast cancer. So put it in perspective, in the United States, we have 1 out of 8 women, which is a big number. 1 out of 8 women will be diagnosed of breast cancer. But fortunately, only 1 out of 9 women will die of breast cancer. The vast majority will all survive.
So it's a survival rate of almost 70%.
Yes, it's in the early stages, the breast cancer survival rate is actually more than 90-95%. And even the 5-year survival rates of stage 4 metastatic breast cancer is also like 30% of the women will be alive with breast cancer diagnoses after 5 years.
Breast cancer that's widespread.
Yes, it's very widespread. And if we talk about Muslims, unfortunately, there's a haya, there's a modesty, and there is a lack of getting screened, and social taboos and the stigma. So unfortunately, Muslim women generally do get diagnosed at an earlier age, but at a later stage, that their breast cancers have, most of them are, many of them are spread already. They do not get diagnosed, unfortunately, at an early stage.
And the thing about cancer is You may have heard that there are
Yeah.
different stages of cancer, right? There's stage 1, 2, 3, and 4. Stage 4 cancer in general means cancer that is spread beyond where it started in the body. So in the case of breast cancer, beyond the breast. It's spread to the liver, spread to the bones, it's gone to the brain, things like that. Once the cancer spreads beyond where it starts, there's no way to cure it or get rid of it. There are treatments, depending on the type of cancer, that can slow it
Yes.
down, but you can't get rid of it. That's why what Dr. Minhas is talking about is so important. It is a taboo in our community for sisters to go and get screening or go see the doctor as well, because they may be shy to do that. That may be one of the reasons. And then they may not even know that these screenings are out there. We're here to say, we're not scholars, of course, but from a medical perspective, definitely get your mammogram done. And Dr. Manas will talk about that in just a minute, but get your mammogram done. Get that screening done. This is preventable or treatable at least, right? If you're able to catch it early.
Right.
So, Dr. Minhas, can you tell us a little bit about, just briefly, what the different types of breast cancer could be? Like, is it mostly localized or spread, or what is it?
Yeah, so let's say, as Dr. Shan Khan has said, that most of these breast cancers, at least in this country, are localized. They're caught early, and only like 10-15% are kind of metastatic. At least 6% of the people actually present with metastatic cancer.
And what that means is, localized means this is confined to the breast,
Yeah.
and metastatic means it's spread beyond that part.
So any cancer which is short of stage 4 is curable, okay? And vast majority in this country will be, presented at early stage. As far as the types, are concerned, they put in the same basket, but they're very, very different. At least we have 3 broad categories, and they're very treated differently. You may have a very small breast cancer, which might require very aggressive therapy, and then you have a large breast cancer, which may not require much therapy or just take some pill, for some years. So it's a big basket, but in general, women at an early stage, at an earlier age, when they get diagnosed with breast cancer, especially they're premenopausal or before the age of 50, their cancer behaves more aggressively than older women. Older women have more chance of getting breast cancer, but their breast cancers tend to be slower.
You're mentioning some risk factors. Can you tell us about other risk factors that our sisters should be looking out for?
Yeah. So when we talk about risk factors, first of all, let's take out the diet. Okay, there is no diet which will prevent cancers in general or breast cancer. I hate to say it, healthy, eating habits and all are very good, especially for cardiovascular risk factors.
For your heart.
Right, but for your heart, but there is not much data to support any diet or anything. So the things which put people at risk of breast cancer is there are modifiable risk factors and unmodified risk factors. For example, the longer the reproductive years are of a woman, let's say early menarche, late menopause, they are more at risk. And then the family history. And I will take a moment to what Sheikh had said. So the sister who said that, a lot of people in her family have breast cancer, and she didn't want to go because of the fear. She has like probably 10 times more reason to go and get checked, because she might be curable at this stage. And if we find a gene, we exactly know what to do with it. Medicine has come a long way. If we find a gene which puts at a risk of breast cancer, we can also tell what family members, her daughters, her sisters, need to be screened for what kind of gene. And not just breast cancer, we will be able to tell, as it will put them at risk of ovarian cancers or endometrial or other cancers they have to be looked for. So it's all the more reason to get checked.
Smoking.
Yeah, so some of the other risk factors are, smoking is a small risk factor, but alcohol certainly is. Actually, in breast cancer, there's a lot of data to support that lack of physical activity, obesity are risk factors. And some of the other risk factors are actually the Western lifestyle also, like, late marriages and delaying the childbirth to a later age. Lack of breastfeeding is actually a risk factor, not huge, but there are certain risk factors.
So With that in mind, we've heard about some of the risk factors. Is there a way to detect the cancer early?
Yeah, that is the $1 million question that we need to kind of home in. And yeah, so there was some disparity in the sort of the U.S. Preventive services who recommend breast cancer screening, but now everybody's on the same page that women need to start annual or biannual breast cancer screening starting at age 40. Starting at age 40. Breast self-exams are never actually been shown to decrease the death in breast cancer, but there's a recommendation that you start them as early as age 20. Self breast exams and also, so at age 40, one needs to start for breast cancer screening. And it's an easy, non-invasive kind of test to do. It's not very difficult. It's all covered by insurances. No insurance will ask you to pay a copay or anything about screenings. They better pay for screening rather than you getting a breast cancer and giving hundreds of thousands of dollars in treatment for that.
What is the survival for cancer if it's caught early and in one place versus if it's already widespread?
Yeah, so it varies depending on type of breast cancer, but in general, the breast cancer diagnosed in women, 90% of it will be curable at an early stage. Stage 1, 2, 3, it varies with that, but vast majority will be curable. As I said before, it's very common 1 of 8 women are going to get breast cancer, but only 1 out of 9 women will die from it because most of them are caught earliest, especially in the Western countries or in the United States. So I believe that that's one reason for us to live in sort of more of, and not just for, financial or other opportunities, but because we have good health coverage in this country that many people in the world would be, very, very interested to get, and they don't have that.
So when people hear the word cancer, they think about chemotherapy, and that is something scary for people. They have side effects. They hear hair may fall out. They may get nausea. They may not be able to eat or have diarrhea. I know there are a variety of treatments you can do depending on the type of cancer and the specific factors of the cancer, but in general, what would you say to people who ask, well, we're scared of the treatment for this type of breast cancer. What can we do about that?
So, again, that's a wide subject, but for breast cancers that are curable, detected early, even if people require chemotherapy, and many of them will not require chemotherapy because their cancer will be driven by their hormones. So we may just need to give them a pill or injection to block their hormone, right? But if somebody's cancer does require chemotherapy, it's going to be finite. It's not going to be forever. And there'll be a light at the end of that tunnel. You will get done. Even if your hair fall out, the vast majority, they will grow. You'll be a cancer survivor. We have millions of women in United States now who are actually breast cancer survivors. I think 8 or 10 million people are breast cancer survivors. And the other thing is that chemotherapy has come a long way. Many of these treatments are not the ones who make you kind of very, very sick. And our supportive care for the cancer treatments is very good now. Well, there is nausea or other things, even hair loss, we have ways how to kind of see if we can try to prevent that. But let's say if you have a cancer which has gone to stage 4 or advanced, then there's no cure for it. You can extend your life with different treatment, but the treatment will be ongoing forever, for how long you live.
Right, as long as you're able to tolerate the side effects, right?
Yes. So I'll tell you, the vast majority of breast cancer, other cancers that do, it's very rare for us to now have somebody go in the hospital for a complication that happened because of the chemotherapy. There are people who go in and vast majority do not die from those complications, but it's very rare that we'll have to admit somebody for a chemotherapy-related complication.
You mentioned side effects, like if people have nausea or pain. We do have, I want to tell you that we do have a team There's a specialty in medicine called palliative medicine, which is one of the things that I do, that focuses on taking care of people with serious illness and helping them get through the spiritual, the psychological, and the physical difficulties that they have with illness, like symptoms they may have, like cancer pain or nausea or trouble sleeping, or what Dr. Minhas was talking about. It's a team composed of doctors, nurses, medical, physician assistants, and nurse practitioners, and a chaplain and a social worker. And they see the patients early. They see them when they get diagnosed usually, and they follow them as they're getting their cancer treatment throughout the course until they come kind of to the end, if they're at that point, at which time they do hospice care, which is a topic for another day. But basically, it's a team that works closely with the cancer doctor to try to help the patient feel better so they can fight better, as one of my teachers said. So basically, that's kind of what we want to talk about. Dr. Mas, do you have anything else before we open up for questions from?
Yeah, and I would encourage, just emphasize in their home that, you have to have this mammogram. It does affect men, but only 1% of the breast cancer patients are men. But definitely those men have sisters and mothers and wives and all loved ones. So just to emphasize that this is important. You don't want to be diagnosed. Life and death is to Allah Subhanahu wa Taala. But as I think there's a hadith saying that Allah has not created disease for which Allah has not created atonement or a cure for that disease.
Except for death.
Except for death.
Jazakallah khair, Dr. Minhas.
And I would encourage, if anybody has any questions, feel free to ask and here, or I'm available all the time. And if the sisters have any questions, feel free to ask.
Yes. Please go ahead and ask your questions. Are there any questions? Yes.
Right. Right.
Okay, so the sister has 3 questions. One question is, what is the treatment plan and how long does it last? We'll answer that, and then we'll talk about the second question.
So the treatment plan, if you look at it because this is so much different type of breast cancers. So the treatment plan could be, as far as chemotherapy is concerned, it might be just 4 treatments, once every 3 weeks, and that's it. And the vast majority of treatments, do not go beyond 3 months. Having said that, this other part of the treatment, let's say if it's immune therapy or targeted therapy for certain type of breast cancers, that can go on for a year. But those treatments do not make you sick. The side effects or profile is not that bad. The hormone treatment will, let's say somebody has breast cancer, goes to 5 to 10 years or 5 to 7 years of taking a pill every day, and So to answer the question about lumpectomy, we have many trials, many randomized trials, which have told us that lumpectomy and mastectomy, when you take the breast off or the mass off, is pretty much the same, except the only difference is that when you have a lumpectomy done, just the mass taken off, then you also have to have radiation with it. After you do a mastectomy, the whole breast taken off, you do not need mastectomy in most cases, except some. The results, the survivor is very, very similar. So except in vast majority of the people, we do not need to take their breast off. We can give treatment, almost the cancer many times would disappear even before surgery. So, so we try to avoid mastectomy unless somebody has this fear or a personal, there are women who come and say, we have, bilateral mastectomies by choice or both the breast removed. There is absolutely no reason, unless there is a genetic predisposition, that we would recommend that no, you need to have both of the breasts removed because your risk of cancer is very high. Otherwise, lumpectomy plus radiation equals mastectomy.
The surgical treatment basically for breast cancer. Did we answer the questions? Okay. What other questions? Yes.
It's not.
Assalamu alaikum. Jazakallah khair, Doctor.
Careful.
On the causes, is it mostly genetic? I keep hearing the genetic factor, but is there any other causes related to breast
Well,
cancer?
yeah, so, genetic means, in the true sense, genetic means that it is carried in families. So, like what the Sheikh Zakas told us about a lady who has many of family members of breast cancer. Even if you don't find a gene, her risk of breast cancer is higher than the regular population. So that is the true genetics. All cancers, in essence, start from a gene. Something goes wrong with our genes, and the blood and the cells keep on multiplying. They're supposed to stop after they multiply to a certain extent. Okay, so, but the vast majority of the cases are not genetic. And also, they are not related to something that we do right or do not read right, whether it's, smoking or exercise or anything. Vast majority of cancers just happen, okay, unfortunately. So that's something not under our control.
But there are types of breast cancer that are inherited and in families.
Yes.
There's the gene is called the BRCA gene,
Right.
and that's not the majority of breast cancer, right?
No, that's only like a very small percentage. It used to be just the Ashkenazi Jewish people who were at risk of those genes. But since there is so much intermixing of genes, we find it across all races and everybody, these genes. But yeah, but vast majority are not genetic.
And typically the people that have that have a strong family history, basically.
Stress issues? Because
Sir?
these cells, actually mutate and react under certain circumstances. And I know one golden rule, proper level of relief in stress tissues is healthier than the non-stressful. So would a stressful life for a certain population would be a driving cause for cancer besides the genetic and whatever the food that the diet that they eat or what have you?
Yeah, as I said before, the diet, obesity is a risk factor. Some people can be just obese without eating too much. So the diet is not a major risk factor for cancers. This might be counterintuitive to what we are taught, but this is actually, more scientific based. The other things can be, one thing we didn't mention was like hormone replacement therapy. Many times women after menopause would get estrogen treatment, and they still do. So at one time we thought it was the female hormones we were replacing, they're good, but they're actually a risk factor for getting breast cancer. So vast majority of them just happen beyond factors under our control.
Part of the question was also, does stress play a role in
Stress.
in the risk?
Stress has more to do with fighting, the cancer or the treatment with it. But no, stress is not a risk factor. If you're stressed or not stressed, it's not going to make a difference in whether we're going to get breast cancer or not, or any cancer for that matter.
Other questions?
Does reoccurrence rate is high for survivors?
So the question is the recurrence rate high for survivors of breast cancer?
Yes, it is higher for survivors because they already have had breast cancer, but the screening, unless they have a genetic risk, the screening recommendations do not change. But their main fear is that there are certain type of breast cancer which can also relapse after like 10, 20 years. So certainly, and regarding this, you brought an important point. Survivorship itself in breast cancer is a whole field, a whole specialty, because like we have so many breast cancer survivors now, and then you see these long time effects, maybe on the heart for some of the chemotherapy related, or emotional side effects, or other side effects, family side effects. If somebody gets cancer, it affects the whole family. The whole. So there's a whole field of survivorship. To deal with breast cancer survivors. There is, but the risk is, yes, it is higher.
Are there any other questions? Sisters? No. Yes.
Oh.
Saad, yes. That's okay. Let me know when you remember. Any other questions? Yes. Let me know when you remember, okay, Saad? Yes, brother.
Thank you, doctor, for
Anytime.
the insights. So, does mastectomy can present a risk for metastasis of cancer to other organs? So, if the doctor recommended a mastectomy, so does this can be a risk factor for cancer to spread to the brain or some other tissues?
So the brother's asking if a sister gets a mastectomy,
yes,
does that make the cancer metastasize or increase the risk for the cancer to spread to other organs?
Okay, I'm so glad you asked that, and that is actually sort of a very strong held notion or a belief, especially in some of our community here in the United States, especially in the African American community, that you touch these cancers or you open it, cut it, it will spread. But cancers do not spread that way. They don't spread by air or anything. They spread by the bloodstream. Okay, and by the time a cancer has appeared, even like less than a sort of a centimeter, millions of cancer cells are already floating around. So that's something you cannot prevent. But no, the cutting or anything like that, a mastectomy is not going to make the cancer spread. They have an inherent potential. That's the nature of these cancer cells, that they like to spread, take root in some place and grow. So that's an inherent potential, mostly driven by the bloodstream.
What was your question?
Like earlier when you get cancer, is there a sign you can tell they have cancer, like before you get any treatments or anything, like sharp pain?
Yeah, this young gentleman asked a very good question. So unfortunately, that's one reason the cancer is called silent killer, because vast majority they like to grow and actually not give any symptoms. That's one reason. They don't cause a fever. They don't cause anything else that we know something is wrong with the body. And for example, we're talking about breast cancer. If you have a painful breast mass, we will be less worried. If it's a painless mass which is not causing any problems, it is breast cancer until proven otherwise. So they are a silent killer. They would not declare. That's why all these screening and these things are so important.
Good question. Are there other questions? Yes, sister. So the sister asked, are there any resources or websites where they could go to find more information?
Yeah, so if you just Google breast cancer, there are so many things where you can, or places or sites where you can find breast cancer information. One very good would be American Cancer Society, and that will have a lot of resources. But this is there's more research dollars and money going into breast cancer because it's a women issue than lung cancer or other cancers combined. So there are a lot of resources available.
But the American Cancer Society is a good place
Yes.
to start. Any other questions? If not, Jazakumullah khair. Thank you so much, Jazakallah khair, Dr. Minhas, for joining us. We're very glad you're able
Thank
to
you
join
for
us.
inviting, and thank you for arranging this.
And Jazakumullah khair for sticking around. We will have our next one the second Friday of November, inshallah. And you'll see announcements about the topic at that time. So we'll conclude with dua inshallah. Subhanakallahumma wa bihamdik. Nashhadu an la ilaha illa anta nastaghfiruka wa natubu ilayk. Wal 'asr innal insana lafi khusr. إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وآخر دعوانا عن الحمد لله رب العالمين السلام عليكم ورحمة الله وبركاته